Anterior hip replacement surgery is a minimally invasive type surgery for total hip replacement. Traditional approaches go through the side or the posterior aspect of the hip where you're cutting muscles. When we go through the front of the hip, we don't cut any muscles, we spread the muscles apart, and it allows us to perform a hip replacement, but it's completely muscle sparing. So that allows patients to recover much quicker because you haven't cut the muscle and you're not repairing it at the end. So by sparing the muscle, patients can get up and walk and have a quicker functional recovery compared to the more traditional side or posterior approach, the lateral or posterior approach to hip replacement surgery. Usually my patients at 2 weeks are driving, and they're typically off walkers on a cane, and some patients at 2 weeks are walking without any gait aids whatsoever.